Hello, my name is Malkia Newman, and I have the honor of doing the BoardWorks presentation on intended beneficiary command, which is a very complicated word sometimes, but basically when I think about this session, I think about the power of peers, the power of consumers and their role on a CMH board. I was appointed to a board in 2007. I've served as a consumer representative, and I've also been involved with the senior leadership of that board. So I know that consumers can and do make positive contributions in their role as board members. So in today's discussion, our course objectives are to examine the partnership relationships between providers, public and private, the people served by the mental health system, and the community at large. Also, we're going to look at the strategies for promotion and support of customers, consumers into leadership roles, including administrative, management, and service delivery. We also want to underline the value of customer-consumer involvement in all areas of the mental health system, including assessment, evaluation, planning, management, monitoring, and improvement efforts. Last but not least, we also want to examine strategies for promoting and supporting the choices of informed, responsible, and prudent purchases of services by the system's customers. So before we go on, we do want to clarify the term intended beneficiary. If you've been involved with the community mental health system for any length of time, then you know that there's been quite a few names given to the people who receive services of this system. We've been called patients, clients, consumers, and that's just to name a few. What we want to avoid during the course of this discussion especially is labeling, because labeling has a tendency to demean and dehumanize, and many times it causes people to act in manners that reflect the labels that they've been given. So the term intended beneficiary is used to show the unique relationship between customer, consumers, peers, or whatever your particular organization calls the people who receive services or have lived experiences with the CMH, SPs, private providers, and the community as well. These are the partnerships which should be built on a foundation of mutual respect. Very important. So let's start out by talking about consumer leadership. The consumer movement has been in existence for quite some time, which I'm sure you know. Peers have made valuable contributions to the community mental health system. The unique role that customer consumers can fulfill within the community mental health system, it cannot be underestimated. Community mental health agencies that have involved consumers in leadership and evaluation roles have found that the consumers' insights and contributions have been invaluable. Community advisory councils is one way to provide valuable leadership training and opportunities for customer consumers, as well as preparing them to serve as primary and secondary members of the PIHP's and the CMHP's board. Customer consumer involvement is not limited to the local public system, but it is also essential to private sector providers as well. Some of the qualities that are needed for a consumer that's interested in leadership. Number one is passion. We bring a passion to this discussion that nobody else can bring. We've been the recipients of services for many years through the community system, and we know what works and we know what doesn't work. And those of us who have been groomed for these leadership positions, we bring this passion with us to our mission on the board. Another important thing is having a concern for others. You can't be selfish. You have to be concerned about others, and not just the people receiving services, but you're concerned for your fellow board members, you're concerned for the staff that works along with you, as well as any other stakeholders that have a concern about the community mental health system. We should always be improving consumer leadership through education. Every opportunity that you have to educate peers to help them in their role is invaluable. And last but not least, if you're considering being a consumer in leadership, you have to have the ability to serve. If you're not in a position to give time to the board, then we would not recommend that you take on this responsibility, because it's a very high learning curve, and you do have to make yourself available for a lot of study, meetings and such, and we want to make sure that you can be fully engaged before you take on this responsibility. Ways that the board members can assist any consumers that are their partners on the board. Providing an orientation to board rules and responsibilities is key. It also helps if you can provide a mentor. When I came to the board in 2007, there was another board member who served as the vice chair of that board, who was also a consumer. And he was very instrumental in grooming me and assisting me and helping me to be comfortable in my role as a consumer board member also. Another thing that's important is that for all board members to respect the consumers for their views and their ideas. We've been recipients of the system, the services of the system, and we do know what has worked for us. It's not a cookie cutter system, it's very individualized. And when we bring our perspective to the table, it helps the other board members to understand how the policies affect the people that are served, and how the financial aspects can affect the people that we serve. So it's very important that their views and ideas be included. As I said, I've been doing this since 2007, and I've met consumers all over the state who are serving in board capacities. And it really bothers me when I hear consumers say things like, well, I'm on the board, but I'm not even allowed to vote. I don't have a voice at all. And hopefully that's not going on the board that you serve on, because consumers are key. We were included for a reason when they wrote it into the mental health code that consumers, primary and secondary consumers, needed to be involved on the board. It was very important to do so, because we can help in ways that people who haven't personally benefited from this system can't help. Also provide other opportunities for the consumers on the board to talk with other consumers. It's invaluable. It helps us to gain insight, and it also helps us to develop our ability to express our point of view when we come to the board table. Another important thing is, whenever possible, provide consumers or customers an opportunity for employment, whether it's strictly employment on their own or supported if necessary. You're sitting side by side with professionals at the board level, people who have incomes, people who have transportation, and you don't want to put consumers at a disadvantage of sitting at a table when they don't have their basic needs met, and expect them to be able to concentrate on the work at hand. So whenever possible, it's good to make sure that there is some type of income coming in, not necessarily just the stipends, but an income that can help to sustain them as they do this work. Another important thing is being sensitive to the needs of the consumers, primary and secondary, that are sitting on your board. You want to be able to accommodate them as much as possible to make sure that their needs are met. So again, they can focus on the business at hand. Other benefits of consumer leadership. We talked about employment, compensated opportunities. Some people are able to hold down full-time jobs. If those opportunities are available, that's great. But part-time can't be minimized either. Sometimes people have not held positions in some time, and it helps them to be able to acclimate themselves to the world of work through either part-time or shared time or internship opportunities. Volunteer opportunities cannot be minimized either. Volunteer opportunities are another good way to help to develop leadership for the peers that serve on your board. And it's helpful to have the per diem and the stipends, the transportation, and other supports available to them, so again, they can focus on the work at hand. So now we want to talk about the different parts of the board where consumer input is most important. The first being the policy, public policy management, opportunities for consumer involvement at that level. First, we're dealing with governance and executive leadership. First of all, let's talk about governance. When we're appointed to the board, we want to make sure that the CMHP that we're involved with, that we're able to help them in terms of policy direction and provide oversight. The consumers on the board can bring a richness of personal experience as well as our passion, and it blends very well with the other community leaders that are seated at the board. And it creates excellent opportunities for the board as a whole to make quality decisions, which we all are responsible for making quality decisions. Executive leadership, the top leadership at the CMHP, CMHSP level, starting with the executive director. This is where you ensure that the policy direction of the board is carried out through your executive director. And much like governance, consumers working with the executive staff can provide some very valuable information that will assist them in making decisions, making priorities, what items are most important for their organization to focus on at that time. Recruitment of consumers at executive level positions should also be considered. Just because a person has received services from the system, it doesn't mean that they don't have quality input to give to the system. Next, we want to talk about utilization management. And utilization management is a system-wide effort to ensure fairness in providing supports and services to the people served by the community mental health system. We want to make sure that the services that are received are the right type, in the right amount, in the right duration, and is outlined in each and every one's person-centered plan. Consumers greatly benefit from the improvements made to uniform standards of care and support. We want to make sure that everybody gets what they need in order to support them on their recovery journey. System efforts to involve consumers, customers, family, friends, and any other support persons in the person-centered planning process helps to guarantee that the needs and wishes of each consumer will be properly addressed. Utilization management helps to ensure that. Next, we want to talk about quality management. Quality management is a careful review and analysis of the many practices and programs performed within each community mental health organization. Recovery is one of the most important quality of life concerns for our mental health consumers and their support persons. To guarantee that successful outcomes are being reached by all, is whenever possible, we need to be able to measure how effective the recovery process has been. To guarantee that successful outcomes are being reached by all, whenever possible, recovery goals should be measured. There are many tools available to measure recovery and help to educate consumers in their important role as system evaluator. Experiences with mental health issues also give consumers unique insight about the data that's being collected, as well as the programs that are being provided. Consumer evaluation can also help identify areas that need improvement within each organization structure. Now we want to talk about customer service. Customer service in any organization is provided to customers to ensure quality interactions with people served as well as staff. Any problems, questions, or assistance needed, staff is available to help resolve those issues. Consumers are useful as systems navigators as well. Their expertise is important in providing exceptional community learning opportunities, conducting consumer satisfaction surveys, as well as focus groups. Recipient rights, very important. The Office of Recipient Rights is designed to protect the rights of consumers. There is an important advantage to involving consumers in the function of the Office of Recipient Rights. We are excellent resources to educate people about their rights and also in investigating any complaints that are received by any organization. We're also valuable in providing outreach education about rights to the community mental health system at large. Finance. Show me the money. Finance. Having a good understanding of the financial area is vitally important. Proper fiscal management ensures successful operations and a good quality of life for the people served by our system. Each board member is responsible for approving annual budgets for their organization, working alongside finance staff to understand all those reports in order to make sure that we're making informed decisions about our agencies. Show me the money. That's very challenging for staff to provide documents for us that are user-friendly. Many times when I'm in meetings, I have to ask them, what do those acronyms mean? What does this mean? What does that mean? I'm almost famous for raising my hand to say, I don't understand. I used to be hesitant at first because you don't want to appear like you don't know what you're doing. But think about it. We meet once a month for 12 months. That's 12 meetings a year. That's a huge learning curve. And finances is one of the most important areas that we have to learn. So making it easier for people to be in an environment where they feel comfortable asking their questions and getting the support that they need to aid and assist in making these very important financial decisions is critical. We want to be able to supply the information about the different revenue streams that we're dealing with. And all of this enhances our agency's ability to remain solvent in troubled economic times. Very, very important. Next, we want to talk about access. The community mental health system is undergoing many changes, which I'm sure you're all well aware of. One of the things that has been devised in some organizations is to have access, a single access point where consumers are connected and then placed to receive the services that they need. The access point is another great place to include consumers. Our insight and sensitivity about mental health issues have been shown to be a very great benefit to people who may be in crisis. At times, you can't overstate how important it is when a person is in crisis to have someone that they can talk to that really understands what they're going through and how they're feeling at that time. Peers are starting to be included on every level, from the first contact with individuals when they're admitted into psychiatric hospitals. Peers are also serving as advocates in community settings. We also assist individuals who qualify for benefits from many different systems, including the veteran system. And peers are also being included in monitoring eligibility decisions that are made to make sure that when a person is denied benefits, that they have had their due process. Peers are also spearheading community outreach efforts to make sure that underserved populations know where they can go to access services through our system. Next, we want to talk about community collaboration and capacity building. This is the assurance of a system that's being a part of the whole community. This includes efforts of joining in endeavors with other community partners, including creating needed community resource capacity, such as housing, transportation, employment, just to name a few. Consumers can help build partnerships within the community. We bring our own unique knowledge of the system to the community in a way that others can't. We bring our own personal stories, we share our strengths, and we're able to help other people identify much needed resources to help improve their quality of life. Advisory committees. Advisory committees are very key to helping to develop leadership. Some of these committees include the Recipient Rights Advisory Committee, Consumer and Family Advisory Council, as well as other advisory groups and commissions within the community. These boards, committees, provide valuable experience in helping to develop leadership for people who are participating in governance within the mental health system. But don't minimize it to just the mental health system. There are other civic positions as well that consumers can serve, such as citizen police commissions, jail diversion advisory commission, and housing authorities, just to name a few. We don't want to limit the scope and influence that consumers can have within the community. Policy, planning, and evaluation. How can you know that you're doing a good job? This refers to the board and the organization's efforts to evaluate policy development, review policies that are already in use, and approval of short-term and long-term plans. It is vital for consumers to be actively involved in all of the above-mentioned activities, especially influencing short and long-range organizational plans. Customer-consumer involvement includes facilitating stakeholder and focus group meetings, involvement in the evaluation of the supports and services provided by our system, and the implementation and management of evidence-based practices. Very important. Provider network management. Not all CMHSPs have a provider network, but if you do, this is a very important function. This is the place where the relationship between the public policy management at the CMH level and implementation at the provider level is maintained. Functions include general contract management, provider orientation, and learning opportunities, and the coordination of provider network monitoring. This is a great area for consumers to influence provider learning as well as monitoring provider efforts. Public policy implementation opportunities. There are many. Supports is one of the first. We all need support in our lives to pursue and achieve the real life outcomes and maintain our quality of life, not just people receiving services within the system. We all need support. But this is the essence of the person-centered planning process. For consumers, this may also include community resources as well as supports that are related to personal challenges. Services. Services are intended to work with the supports that people receive as well as the treatment that people receive. Treatment. There are a variety of medical and clinical services that might be needed for a short or long period of time, such as a physician, psychiatrist, nurse, or occupational therapist. The key is having a professional who works with consumers as a partner to focus on how their particular treatment relates to the desired quality of life outcomes that the consumers have come to expect. There are many different methods involved with supports, services, and treatment. The traditional method is residential or day programs. Then you have the more non-traditional method of supported living, supportive employment, as well as supportive education. Consumer. Consumer-operated clubhouses, drop-in centers, and peer-delivered services. This is becoming a lot more common as time goes by.